fix a concave chest.
Those patients especially that have a low BMI or very tight capsular contracture where the implant is literally sinking into the chest, there is a contour deformity that occurs, sometimes more, sometimes less, sometimes not at all. And now, because of the constant pressure on the rib by the implant, it causes a concavity effect. Now, when the implants are removed and the burden, the pressure of that implant on the rib that's constantly remodeling is gone, you will see the rib cage expands upward and outward whenever someone takes a nice deep breath. And as you will see, that indentation over the next 3, 5, 6 months, a year, year and a half kind of expands out. That in itself helps with the contour deformity. Now remember, majority of the times the implants are placed below the muscle, so that muscle is cut. So that muscle truly has not been utilized over the years. Because anytime you start moving your arms and use the pectoralis major function, you'll only compress the implant underneath and compress against the rib. You would be bouncing your breast implant around, and this is that dynamic movement because of the muscle movement. And so you have atrophy of the muscle as well, let alone the cutting of the muscle, which compromises the muscle function. So you will see that contour deformity certainly improves because there is no mechanical pressure on the rib cage. The other thing to mention here is, with the implant gone, now the breast tissue, which atrophies as a result of the proximity of the breast tissue being next to the implant, now the breast tissue gets a chance to breathe, expand out, since it's not competing for the limited space, and you will see the breast tissue fluffs out over time. And so between the concavity, fluffing effect, the 5, 10, 15% muscle mass as patients add to their pec minor and the latissimus deltoid serratus, and between the recoil of the skin. Remember, anytime you take full thickness skin, especially on a young person like 30 or 25 years of age, it shrinks, contracts, retracts by almost 30 to 40%. So you can see that in itself, with the implant being removed, that in it basically helps with that recoil of the skin. And with the gravitational pull of the implant down as a result of the implant pulling the breast tissue down, you will see the breast tissue inevitably recoils up. The younger you are, the more so it does. And between all of these 5 modalities, you will see the patients aesthetically do very well. And number 6, that excess skin that I remove in my Facebook Lives, as you will see. And then the medial and the upward movement of the breast tissue, which is pseudo lift. Most of the patients do not need that unnecessary formal lift. No cutting around the nipple areola, no cutting up and down. And the patients overall do extremely well when it comes to their aesthetics. Almost 80% do not need that unnecessary lift.